Welcome to Road to Nursing License 101. In today's NCLEX practice session, we're focusing on one of the most tested and often confusing topics on the exam, delegation. Many nursing students lose easy points on the NCLEX simply because they are unsure about what tasks a registered nurse, RN, can safely delegate to a licensed practical nurse, LPN, LVN, or an unlicensed assistive personnel, UAP. Delegation questions test your ability to think like a safe and effective nurse leader. The NCLEX expects you to understand who should do what while keeping patient safety as the top priority. Remember the key principle. The RN is always responsible for assessment, teaching, planning, and evaluation, while tasks that are routine, stable, and predictable can often be delegated. In this video, you'll work through 50 NCLEX-style delegation practice questions designed to strengthen your critical thinking and help you quickly identify which tasks can be delegated and to whom. Each question includes the correct answer and a detailed rationale, so you can fully understand the reasoning behind every decision. Take your time, think like a nurse, and try to answer each question before looking at the explanation. By the end of this session, you'll feel much more confident tackling delegation questions on the NCLEX. Let's begin. Question 1. A registered nurse, RN, is assigning tasks to the healthcare team on a medical surgical unit. Which task is most appropriate to delegate to the unlicensed assistive personnel, UAP? A. Administer oral medications to a stable patient. B. Measure intake and output for a stable patient. C. Perform an initial assessment on a newly admitted patient. D. Teach a patient how to use an incentive spirometer. Correct answer, B. Measure intake and output for a stable patient. Rationale: UAPs can perform routine, non-invasive tasks for stable patients. Measuring intake and output is within the UAP scope. A. Medication administration must be performed by a licensed nurse. C. Initial assessments are RN responsibilities. D. Patient teaching must be done by the RN. Question 2. Which task should the RN delegate to the licensed practical nurse, LPN? A. Initial assessment of a post-operative patient. B. Reinforcing teaching about wound care. C. Developing the care plan. D. Evaluating patient response to medication. Correct answer, B. Reinforcing teaching about wound care. Rationale: LPNs can reinforce teaching already provided by the RN. A. Initial assessments must be done by the RN. C. Care planning is an RN responsibility. D. Evaluation of outcomes is performed by the RN. Question 3. The RN is caring for 4 patients. Which task is most appropriate to delegate to the UAP? A. Check blood glucose on a stable diabetic. B. Assess a patient complaining of chest pain. C. Provide discharge teaching. D. Start an IV infusion. Correct answer, A. Check blood glucose on a stable diabetic. Rationale: blood glucose monitoring using a glucometer can be delegated to UAP in many facilities if the patient is stable. A. Chest pain requires RN assessment. C. Teaching is RN responsibility. D. IV initiation requires licensed personnel. Question 4. Which patient care task should the RN perform personally? A. Bathing a stable patient. B. Feeding a patient with dysphagia. C. Changing bed linens. D. ambulating a stable patient. Correct answer, B. Feeding a patient with dysphagia. Rationale. A patient with dysphagia is at risk for aspiration, requiring skilled nursing judgment. A, C, D. These are routine tasks appropriate for UAP. Question 5. Which task is appropriate for the RN to delegate to UAP? A. Assess pain level after medication. B. Assist a stable patient with toileting. C. Evaluate effectiveness of pain medication. D. Provide medication education. Correct answer, B. Assist a stable patient with toileting. Rationale. UAPs can assist with activities of daily living, ADLs. A and C, assessment and evaluation are RN duties. D, teaching must be performed by RN. Question 6. An RN is delegating tasks on the pediatric unit. Which task can be delegated to UAP? A. Weighing the child. B. Assessing a rash. C. Teaching parents about medications. D. Evaluating treatment effectiveness. Correct answer, A. Weighing a child. Rationale. Weighing patients is a routine task appropriate for UAP. Other options involve assessment, teaching, or evaluation, which require RN judgment. Question 7. Which task is appropriate for the LPN? A. Develop nursing care plan. B. Insert urinary catheter. C. Perform admission assessment. D. Interpret laboratory results. Correct answer, B. Insert urinary catheter. Rationale. LPNs can perform basic sterile procedures, including catheter insertion. The RN must perform care planning, assessments, and interpretation of results. Question 8. Which patient is most appropriate for delegation to LPN? A. Newly admitted patient with pneumonia. B. Stable patient requiring dressing change. C. Patient with unstable vital signs. D. Patient requiring complex discharge teaching. Correct answer, B. Stable patient requiring dressing change. Rationale. LPNs are appropriate for stable patients requiring routine care. Other options involve assessment or unstable conditions requiring RN. Question 9. Which task should not be delegated to UAP? A. Recording vital signs. B. Assisting with feeding. C. Assessing lung sounds. D. Transporting a stable patient. Correct answer, C. Assessing lung sounds. Rationale. Assessment requires clinical judgment, which only nurses can perform. Question 10. Which task is appropriate for UAP? A. Monitoring pulse oximetry. B. Administering IV medication. C. Performing neurological assessment. D. Teaching breathing exercises. Correct answer, A. Monitoring pulse oximetry. Rationale. UAP may monitor equipment but cannot interpret results or assess patients. Question 11. Which task should the RN delegate to LPN? A. Initial wound assessment. B. Reinforcing post-operative instructions. C. Creating discharge plan. D. Evaluating patient progress. Correct answer, B. Reinforcing post-operative instructions. Rationale. LPNs may reinforce teaching but cannot initiate teaching. Question 12. Which task is appropriate to assign to UAP? A. Apply elastic compression stockings. B. Assess pedal pulses. C. Evaluate circulation. D. Provide medication teaching. Correct answer, A. apply elastic compression stockings. Rationale: applying stockings is a routine intervention. Assessments require RN or LPN. Question 13. Which activity requires RN intervention? A. Feeding a stable patient. B. Assisting with hygiene. C. Administering IV push medication. D. Ambulating a stable patient. Correct answer, C. Administering IV push medication. Rationale: IV push medications require advanced nursing knowledge and monitoring. Question 14. Which task is suitable for UAP? A. Measuring vital signs. B. Evaluating abnormal vitals. C. Adjusting oxygen therapy. D. Assessing respiratory distress. Correct answer, A. Measuring vital signs. Rationale: UAP can measure vitals but must report abnormalities to RN. Question 15. Which patient is appropriate for delegation to UAP? A. Post-operative patient with unstable BP. B. Stable patient needing bath. C. New confusion. D. Patient requiring cardiac monitoring. Correct answer, B. Stable patient needing bath. Rationale: bathing is an ADL task suitable for UAP. Question 16. Which task can LPN perform? A. Initial patient assessment. B. Administer oral medication. C. Develop nursing diagnosis. D. Evaluate treatment outcomes. Correct answer, B. Administer oral medication. Rationale: LPNs can administer many medications but do not perform care planning or evaluation. Question 17. Which patient should the RN assign to UAP? A. Stable patient needing ambulation. B. Patient with chest pain. C. Patient with new diagnosis. D. Patient with uncontrolled pain. Correct answer, A. Stable patient needing ambulation. Ambulation for stable patients is appropriate for UAP. Question 18. Which task requires the RN? A. Bed making. B. Feeding patient. C. Initial patient education. D. Ambulating stable patient. Correct answer, C. Initial patient education. Rationale: only RNs should perform initial patient teaching. Question 19. Which task can the RN delegate to LPN? A. Assessing pain. B. Administering subcutaneous injection. C. Interpreting EKG. D. Developing care plan. Correct answer, B. Administering subcutaneous injection. Rationale: LPNs can administer many injections. Question 20. Which task should be assigned to UAP? A. Monitoring urinary output. B. Assessing catheter complications. C. Changing sterile dressing. D. Evaluating hydration status. Correct answer, A. Monitoring urinary output. Rationale: recording intake and output is a routine task. Question 21. Which task requires the RN? A. Feeding stable patient. B. Assessing swallowing ability. C. Assisting with toileting. D. Bathing patient. Correct answer, B. Assessing swallowing ability. Rationale: swallow assessment involves risk for aspiration, requiring RN. Question 22. Which patient is appropriate for LPN? A. Newly admitted stroke patient. B. Stable diabetic patient requiring insulin. C. Patient needing complex education. D. Patient requiring full assessment. Correct answer, B. Stable diabetic patient requiring insulin. Rationale: LPNs can administer insulin to stable patients. Question 23. Which task is best delegated to UAP? A. Changing bed linens. B.
assessing skin breakdown, C. evaluating wound healing, D. educating patient on hygiene. Correct answer, A. changing bed linens. Rationale: bed making is a routine task. Question 24. Which task should RN perform? A. feeding patient, B. recording vital signs, C. assessing new confusion, D. ambulating patient. Correct answer, C. assessing new confusion. Rationale: new confusion may indicate acute neurological change. Question 25. Which task can LPN perform? A. collect urine specimen, B. initial care planning, C. discharge teaching, D. admission assessment. Correct answer, A. collect urine specimen. Rationale: specimen collection is within LPN scope. Question 26. Which task is appropriate for UAP? A. monitoring IV rate, B. assessing IV site, C. starting IV, D. teaching IV care. Correct answer, A. monitoring IV rate. Rationale: UAP may observe and report but cannot assess or start IVs. Question 27. Which patient should RN assign to UAP? A. stable patient needing repositioning, B. patient with unstable vitals, C. post-op patient requiring assessment, D. patient with new symptoms. Correct answer, A. stable patient needing repositioning. Rationale: repositioning is routine nursing care. Question 28. Which task requires RN? A. assessing breath sounds, B. bathing patient, C. feeding patient, D. linen change. Correct answer, A. assessing breath sounds. Rationale: respiratory assessment requires RN. Question 30. Which task can LPN perform? A. administer oral antibiotics, B. evaluate treatment effectiveness, C. create nursing diagnosis, D. perform initial assessment. Correct answer, A. administer oral antibiotics. Rationale: medication administration is within LPN scope. Question 31. Which task is best for UAP? A. obtain weight, B. assess edema, C. evaluate fluid retention, D. interpret lab results. Correct answer, A. obtain weight. Rationale: obtaining weight is routine.
Question 31. Which patient is safe for UAP care? A. stable patient needing feeding, B. patient with chest tube, C. patient with unstable oxygen level, D. patient requiring IV medication. Correct answer, A. stable patient needing feeding. Rationale: stable feeding assistance is appropriate. Question 32. Which task is appropriate for LPN? A. reinforce medication education, B. initial patient teaching, C. discharge planning, D. patient evaluation. Correct answer, A. reinforce medication education. Rationale: LPNs reinforce teaching. Question 33. Which task should RN do? A. assess pain, B. assist with dressing, C. bed bath, D. feeding. Correct answer. A. Assess pain. Rationale. Pain assessment requires RN judgment. Question 34. Which is UAP responsibility? A. Vital signs. B. Pain assessment. C. Respiratory evaluation. D. Medication administration. Correct answer. A. Vital signs. Rationale. UAP may obtain vitals but report abnormalities. Question 35. Which task is LPN scope? A. Wound dressing change. B. Care plan development. C. Evaluation of therapy. D. Admission assessment. Correct answer. A. Wound dressing change. Rationale. LPNs can perform many wound care procedures. Question 36. Which patient can UAP care for? A. Stable patient needing hygiene. B. Patient with acute bleeding. C. Patient with unstable vitals. D. Patient with respiratory distress. Correct answer. A. Stable patient needing hygiene. Rationale. ADL assistance is appropriate. Question 37. Which task requires RN? A. Neurological assessment. B. Bed making. C. Ambulation. D. Feeding. Correct answer. A. Neurological assessment. Rationale. Neuroassessment requires RN. Question 38. Which is appropriate for LPN? A. Insert NG tube. B. Evaluate swallowing. C. Discharge teaching. D. Initial assessment. Correct answer. A. Insert NG tube. Rationale. LPNs may perform many procedures. Question 39. Which is appropriate for UAP? A. Assist with ambulation. B. Interpret vital signs. C. Assess oxygen need. D. Medication administration. Correct answer. A. Assist with ambulation. Rationale. Ambulation assistance is routine. Question 40. Which task requires RN? A. Chest pain assessment. B. Bathing patient. C. Bed making. D. Feeding. Correct answer. A. Chest pain assessment. Rationale. Chest pain is high priority and requires RN evaluation. Question 41. Which task is LPN appropriate? A. Administer IM injection. B. Develop care plan. C. Patient teaching plan. D. Patient evaluation. Correct answer. A. Administer IM injection. Rationale. IM medication administration is within LPN scope. Question 42. Which is UAP task? A. Transport stable patient. B. Assess vitals. C. Evaluate vitals. D. Teach medication. Correct answer. A. Transport stable patient. Rationale. Transportation is non-clinical. Question 43. Which requires RN? A. Assess mental status. B. Feeding patient. C. Bed making. D. Ambulating. Correct answer. A. Assess mental status. Rationale. Mental status assessment requires RN. Question 44. Which is LPN role? A. Reinforce discharge instructions. B. Initial discharge teaching. C. Evaluate readiness for discharge. D. Plan discharge care. Correct answer. A. Reinforce discharge instructions. Rationale. LPN reinforces education? Question 45. Which is UAP role? A. Assist with hygiene. B. Assess skin. C. Evaluate wound healing. D. Teach hygiene. Correct answer: A. Assist with hygiene. Rationale: UAP assists with ADLs. Question 46. Which task requires RN? A. Interpreting EKG. B. Bathing. C. Feeding. D. Repositioning. Correct answer: A. Interpreting EKG. Rationale: EKG interpretation requires RN knowledge. Question 47. Which is LPN appropriate? A. Administer oral medication. B. Initial patient assessment. C. Care plan development. B. Discharge planning. Correct answer: A. Administer oral medication. Rationale: medication administration is within LPN scope. Question 48. Which is UAP task? A. Apply non-sterile dressing. B. Assess wound. C. Evaluate infection. D. Teach wound care. Correct answer: A. Apply non-sterile dressing. Rationale: simple non-sterile tasks can be delegated. Question 49. Which task requires RN? A. Evaluate medication effectiveness. B. Bed bath. C. Ambulation. D. Linen change. Correct answer: A. Evaluate medication effectiveness. Rationale: evaluation requires RN. Question 50. Which patient is best for UAP? A. Stable patient needing vital signs. B. Patient with unstable BP. C. Patient with chest pain. D. Patient with new neurological deficit. Correct answer: A. Stable patient needing vital signs. Rationale: routine vital signs on a stable patient are appropriate for UAP. That brings us to the end of these 50 NCLEX delegation practice questions. Delegation is a critical skill every nurse must master, not just for the NCLEX, but for safe and effective patient care in real clinical settings. Always remember the key rule. The RN is responsible for assessment, teaching, planning, and evaluation, while stable, routine, and predictable tasks can often be delegated to the LPN or UAP. The more you practice delegation questions, the easier it becomes to quickly recognize who should perform each task. Consistent practice will strengthen your clinical judgment and help you avoid common NCLEX traps. If you found this video helpful, make sure to like the video, subscribe to the channel, and turn on the notification bell so you don't miss more NCLEX practice sessions. Here on Road to Nursing License 101, our goal is to help you build confidence, strengthen your critical thinking, and get one step closer to passing the NCLEX and becoming a licensed nurse. Thank you for watching. Keep practicing, and I'll see you in the next NCLEX review.